The earliest known symptoms of PTSD were found and documented in the late 1600s by a Swiss doctor by the name of Dr. Johannes Hofer. He coined the term nostalgia. It was a term used to describe Swiss soldiers who suffered from despair or homesickness, along with classic PTSD symptoms such as sleeplessness and anxiety. Around the same time period, German, French, and Spanish doctors all documented the same symptoms with their soldiers and patients. Another breakthrough came in 1761. An Austrian physician by the name of Joseph Leopold Auenberger published a book named Inventum Novum. In the book, he wrote about nostalgia and trauma-stricken soldiers. He reported that the soldiers became listless and solitary. He also came up with a few ways to combat their feelings. All throughout Europe, nostalgia was noted as a disease for hundreds of years. It didn't reach the United States until the U.S. Civil War. It ran rampant through the military camps during the war. The common diagnosis was that the soldiers who had it were weak and had a feeble will. Public ridicule was sometimes the cure for nostalgia. It was poorly diagnosed and treated in the early stages, causing many to go into severe depression or even commit suicide. After the Civil War, Dr. Jacob Mendes da Costa found and studied the men who were suffering from certain physical issues unrelated to their wounds, such as palpitations, having a difficult time breathing, and other cardiovascular symptoms. These symptoms brought about an overstimulation of the heart's nervous system. The condition became known as soldier's heart, irritable heart, or da Costa syndrome. During the 1800s, it wasn't just soldiers that had these kinds of symptoms. People who worked dangerous jobs also suffered from nostalgia. During the Industrial Revolution, rail travel became more common, as did railway accidents. Survivors of these railway accidents displayed many of the same symptoms as did the soldiers. Most common symptoms were anxiety and sleeplessness. People thought it could be cured with public ridicule, but once again, that was not the case. This condition eventually was to be known as railway spine or railway brain. Autopsy suggested that railway accidents caused small lesions to the central nervous system. As times changed and the Great War began, so did the name of nostalgia. During the Great War, it was known as shell shock. The term shell shock first appeared in the medical journal, The Lancet, in February 1915. The Royal Army Marine Corps documented the soldiers' symptoms, as well as sight and hearing loss due to being exposed to shells on the battlefield. They thought it made a concussion or a shock to the nervous system, hence the name shell shock. Soon the medical staff would find that soldiers that were not even exposed to the explosives, but were just a part of the war, were having the same symptoms and having nervous system breakdowns while on duty. These conditions were considered to be neurasthenia. The terms were still encompassed by shell shock. It was documented that over 80,000 British troops had cases of shell shock. Soldiers were usually returned to the war zone within a few days' rest. Long-term patients underwent hydrotherapy and electrotherapy.